welcome to the Quillen Physicians webinar on preloading. It is recommended that you have viewed the logging in and out of all scripts and the basic navigation for clinical staff prior to viewing this video, as we will assume that you have basic navigation skills. Click on the Clinical Desktop tab on the horizontal toolbar and select your patient. We are going to pull one of our fake super user patients in today. Make sure that you have the correct patient by checking the demographic information in the patient banner. To begin preloading, you will click on the P icon on the clinical toolbar, and this pulls up your Add Clinical Items screen, referred to as the ACI. Clicking directly on the P will automatically pull you into the Active tab, which is where you will add the patient's active problems. We are going to add the active problems of diabetes and hypertension on our patient. To do this, type in the first few letters of the problem in the search field, and then hit Enter or click the binoculars. Check the box next to the appropriate item. Now when you are preloading, you will get an encounter selector box on each patient. Choose New Encounter, the current date, and in the Type drop-down box, choose Chart Update. Click OK, and you'll notice that the item that you just clicked on has pulled into the History Builder section on the left-hand side of the screen. It should have a check mark in the box, and if you click off of it, you can see that it's in pink. This means that it has not yet been saved. We'll go over more on that in a bit. Let's go ahead and type in the next active problem, hypertension. Now there's a couple of things you need to remember about searching in these fields. If you just begin typing letters in the search field, the items that automatically populate before you hit Enter or click on the binoculars are being pulled from your favorites list. This can be a little misleading, as once you get a lot of favorites built up, it will look as though the list you're searching from is fairly complete, but the item you're looking for may not be there. To pull in from the master list, click on the binoculars or just hit Enter. We're going to hit Enter now to show you how many choices come in when you pull from the master list. As you can see, this can be a little overwhelming, so it's highly recommended that you save items to either your favorites list, which lets you save about 200 items, or to your quick list, which allows you to save around 50 items. Saving items to a favorites list or a quick list is simple. Just right-click on the item and choose either favorite item or quick list. Saving an item to your quick list will automatically save it to your favorites list. Now to access your quick list, just click on the Q icon next to this field up here at the top, and all of the items in your quick list will come up. This saves a lot of time with searching. Let's go ahead and click on the Past Medical History tab and enter a past history on this patient. This section basically works the same way as the active problems. Type the item that you're looking for in the search field, and we're going to type in tonsillitis. And once you check this box, you'll notice that History of Tonsillitis pops up over here in the History Builder section. Now let's add some details to this. Say that we want to indicate that the patient had tonsillitis as a child. You can right-click on the History of Tonsillitis in the History Builder and then choose Edit. A Problem Details box comes up. Now notice that you can do a lot on this screen. You can change the status, you can change the problem from acute to chronic or health maintenance, and you can include the problem in the active problem list if it's an ongoing issue that you want listed both as a past medical history and as an active problem. You can also include an onset and resolve date, and you can free text in the description field and add additional details like clinical progress and severity. Let's add some additional details to the description field, and then we're going to click Save and return to the ACI. Now let's click on this plus sign next to the History of Tonsillitis. Notice that the information that you added into the description field can be viewed here. This information will also be available on the clinical desktop. The next tab over is the Past Surgical History tab. Again, you will simply search for the items in the search field. However, if you want to document that the patient has no past surgical history, there isn't an actual no past surgical history option. So in order to document this, type the word history into the search field and search for history of prior surgery. It's usually about the 6th one down from the top. Right-click on this and choose Deny. history of prior surgery will show up in the History Builder section under the heading of Denied. You can do this with any item. You can deny that a patient has a history of alcohol abuse, drug use, smoking, etc. Just right-click and deny. It's important to remember, however, that you want to right-click and deny it without actually checking the box. Denying it will automatically check the box and move it into the History Builder section. But if you check the box and then right-click and deny, it puts it into the History Builder section under Problems, making it look as though the patient does have that particular history. The next tab over is the Family History tab. And this has a neat feature in that it allows you to get very specific in recording the family history. If you don't click on any of the specific family member drop-down items, it will simply record a family history of thyroid cancer. So let's search for thyroid cancer. And you'll notice when we check the box, it pulls into the History Builder section as Family History of Thyroid Cancer. Now if we choose Mother from the maternal drop-down field, and then type in breast cancer in the search field, and check that, it comes up into the History Builder section as Maternal History of Breast Cancer. The next tab over is the Social History tab. And again, this works the same as the others. We're going to type in alcohol use in the search field, and then hit enter. It pops right up there. And again, if you want to indicate that this is a problem, you'll just check the box. However, if you wanted to deny a history of alcohol use, you could uncheck the box, right-click, and deny. And you'll see that this comes in differently. It comes in under a denied heading. Now when entering allergies, which is the next tab over, pay special attention to the two radio buttons next to the search field. The radio button defaults to medication, but if you want to add a non-medication item, you will need to switch the radio button. Again, just click in the box to add items to the History Builder. Let's go ahead and type morphine in under the medication radio button. And again, we've gotten a lot of choices. You can use these tabs over here to take you directly to the section where you want to go, and choose morphine derivatives. Now notice this pops up in the bottom section of the History Builder. Let's go ahead and click non-medication and type in seafood and choose that. Now if we wanted to add a reaction to any of these allergies, we could right-click. Let's right-click on seafood and edit. And in the allergy details box, you can change the status, choose a category, and set a reaction date. In addition, if you click on the binoculars in the reactions box, you'll get an allergy reaction box will pop up in which you can check any of these reactions. If you choose anaphylaxis, a red warning icon will appear in the History Builder section to alert the user to the fact that the patient does get this severe reaction. So let's save and return to the ACI, and you'll notice the icon popped up here in the History Builder section as well. The next tab over is the Medication History tab, and this allows you to put in the patient's medications. This is an important section as there are several items that need to be noted here. Let's document that this patient is on Lortab. And if you click the box next to the drug name, it will put it into the current meds orders section of the History Builder with a status of active. And here we're getting an interaction warning because we put down that the patient has an allergy to morphine. We'll just continue on past this. Now put your mouse over the Lore tab in the History Builder, and you'll see here that it came in under current meds and orders, and it does have a status of active. Now if you're recording a medication that the patient is no longer on, you're going to want to right-click and edit this and change the status from active to complete. Click Save and return to the ACI. Notice that the medication no longer appears in the Current Meds Orders section, but if you change your view to Past Medications, it will appear with the status of Complete, which you can see by hovering your mouse over it. Also, since you are just recording past meds, the system doesn't automatically ask you for prescribing details such as how many milligrams the patient was on, how many times a day it was taken, etc. However, if you have that information and you want to add it in, you may again right-click and edit, and you can add that information in this section. If the patient is currently on a particular medication and you do know what this information is, it's a good idea to go ahead and add that in, as it will save the physician a lot of time when they go to reorder that particular medication on a patient. The last section that you will be pre-populating is the immunization history section. Here we're going to search for flu in the search field and check the influenza box. You'll notice here that a detail box appears, as the system does require a date for the immunization. As you'll notice, the only required field here is the date time field, which is highlighted in yellow. Click on the calendar icon and choose the appropriate date. Now notice that there are some shortcuts here. From the column on the left, you can choose childhood or unknown, and from the radio buttons at the top of the page, you can choose approximately if you're unsure of the exact date. You can also choose NA in the month and date fields. If you click the drop down next to the month, the first option is NA. So if you wanted to say this patient had this immunization approximately 2008, you would check the approximately button, and then in the drop down field for the month, you would put in NA and then change the year to 2008. Click OK, and you'll notice it pops up approximately 2008. You can also free text in this field if that's faster. Then click Save and Return to the ACI when you're finished. Now a couple of other brief items before we quit. You can move across the tabs on the top of the ACI screen without saving or clicking OK in between. In fact, that is recommended. Anytime you click OK from the ACI, it's going to take you back to your clinical desktop, and you'll have to click on the P in order to reopen the screen. So just navigate between the tabs, and then when you're finished putting in all of the information, you can click OK. Now in order to save your information, you're going to want to click the yellow Commit button on the toolbar here on the desktop. You'll get an encounter summary, and once you've reviewed everything and made sure that everything is correct, you'll just click Save and Continue. And you'll notice that all of the items that were previously in pink are now in black. Now in order to view the items that you just entered, you're going to want to change your view on the Problems tab from Active Problems to All, and you'll notice that all of the items that you have put in have pulled in here. In order to view the medications, you're going to go over here to the second component on the desktop and click on the Meds tab. And since we changed that to a past medication, we're going to change our view to past medications, and you'll see that the Lower tab is there. The allergies can be viewed on the next tab, and the immunization history will have automatically pulled into the immunization flow sheet, which is down here in the third component. And you'll see that the influenza popped in here. And that's it. We appreciate your taking the time to view this video, and remember, the more information that is loaded into the charts prior to going live, the easier the transition will be for everyone. Please feel free to contact the help desk if you have any questions. Have a great day, everyone.